Hi there. This video is a brief introduction to our vaccination template. We've tried to gear it in a way that makes it safe and quick and easy for recording vaccinations, particularly if you're in the middle of a really crazy flu season and flu clinic. Now, you might have it on your toolbar, it's this icon here. If not, if the patient's got vaccines that our systems have picked up to give, it's available here next to our red pill icon. If you want, we've also got an option to let this template appear whenever you start a consultation during a flu clinic. Every click saved counts. So on the left-hand side, I can see what vaccinations are suggested. I've got some key information relating to flu. So kind of red, green ticks if it's saying essentially straightforward stuff. If there are concerns, then they're sort of highlighted there, and I can see why they're eligible, and any vaccinations or refusals in the last 3 years. I've set this up to be quite a straightforward patient, and I've also recorded in the background to make the system think I'm a nurse and to just show you how that would normally flow. So flu vaccine, click give flu. So it's worked out that I'm a nurse and checked the eligibility, and then it's picked the right vaccine. This is based upon the patient's age and what we've said we're using as a practice. Let's put in a batch number, and I click OK, and that's it. And on the right here, I can see what it's documented. It's coding given advice. It's coding that it's been given under a PGD because I'm a nurse. Consent that's from the system settings to always record consent, and some free text as well. So the idea is that is about as quick and as easy as we can get it for you during a clinic. Let me just show you on a different patient how it might look when there's a bit more going on. So on this test patient, we can see some recent refusals. We can see they've got lots of indications, but there are also a few flags here. So the fact that they've got high dose steroids, and the details are here. Similarly, that they're on some kind of anticoagulant, again, the details are here. That doesn't mean they shouldn't necessarily have the flu, but we just wanted to flag that up for you. We also have a whole system for recording PSDs, which GPs can use to sort of safely and quickly do those. If I now click give flu, so the system hasn't been able to identify my role. That's because I'm an administrator, and so it doesn't know what I'm doing on this instance. If I were a nurse, it would pick that up. If I was a GP or a HCA and things, it would generally pick those things up. So it's asking me, how am I giving this vaccine? So let's pretend I'm a HCA, in which case I'll be giving it under a PSD. So no PSD has been added this season. Now, it may be that actually you've got a signed document for this patient, and that's fine, and you could record flu PSD signed. But the point is, this flags up, if you are using our system, that it's not picked one up. Conversely, if there was one identified, there would be no warning at this point, and it would just document that it's been given under a PSD. So it may be that if I am a HCA and I've not got a PSD, then I've got to stop because I'm not able to give that vaccine. There are other options in here you might find useful, like recording flus given elsewhere, and then you can backdate it. You can record flu refused. There's a link to the PGD, and also a link to Arden's flu template, which is great if you need more detail or you want to put more information in. And we've kind of replicated that essentially for each of these different vaccines. They all work in much the same way, and there's a free text box you can use as well. But what we're really trying to do here is that for the vast majority of patients, it is appropriate to give them flu. It's quick, safe, and easy. It flags up anything of concern and hopefully helps you with your flu clinic. Thanks.